Start. So welcome everyone. My name's Andrew Coates. I'm Scientific Director and great pleasure to welcome you to the Heart to Heart tonight. It's a fascinating series and we've got a wonderful presentation today from Johnny Liu, who's one of our superstars. First of all, I'd like to acknowledge we're on the lands of the Gadigal people of the Eora Nation, and we all pay our respects to the elders who've looked after the lands for so long, and pay our respects to any other cultural guardians around the lands of Australia. Tonight, we're here to really help you get an insight in some of the very diverse research of the Heart Research Institute, and it straddles everything from directly investigating the muscles of the heart to how the blood vessels work, how they interact with each other, how metabolism works, and how the heart, when it's diseased, can affect other organs. But all that's fascinating insight, and we're all driven out of enormous scientific curiosity. Some of us for many, many decades, haven't they? Jeffrey, we know that knowledge is worth it for its own sake, but we also want to make a difference because we're here to make sure that the next generation will not be as affected by heart and blood vessel disease as ours done. And we are, looking around this room, probably all benefiting from the research of the last 20 years, because we've probably done better than our parents' generation. We want to make sure that is progressing. And to do that, we need clever ways to intervene. There are so many biological processes in the body that we can modify. And one of the really exciting ways is we realize now, when developing drugs, and we all take pills for various diseases, we had a very limited view in how drugs work, and we had a very limited playset of things to look for. And basically, over the last decade or two, we've realized that we can look in hundreds of new places. And we start off looking at the natural world, and we find there are things that have evolved in the oceans, in the forests, in plants, in insects that have already been a natural experiment and they're beneficial. And I'd like to say that Johnny's going to really open your eyes to the possibilities that are out there for the next major advance in cardiovascular disease. So I'll hand over to Katrina, who's going to quiz Johnny and put him on the spot. And I know they've been practicing all day, so it'll be picture perfect. And we really look to hear your questions because we're here for you.
Thank you, Andrew. Thank you. And I promise not to quiz you too hard, Johnny. Good evening, everyone, and thanks for joining us for Heart to Heart. It's our final Heart to Heart for this year. Can't believe that the year's gone by so quickly. So thank you for being here. And thank you to everyone too that's joined us online. We're also always so pleased to have you here, and it's really nice to see familiar faces joining us. By way of introduction, my name is Katrina Dowling and I lead the Development, Philanthropy and Communications team at HRI. And as Andrew said, tonight I'm joined by Dr. Johnny Liu, and Johnny leads the Cardiovascular-Protective Signalling and Drug Discovery Group within HRI. For those of you who are joining us for the first time this evening, I'd like to just provide a very brief overview of HRI, who we are, and why we're so passionate about the work that we do. So HRI is an internationally recognised medical research institute. We're an independent medical research institute with a single focus on researching the causes and complications of cardiovascular disease so that we can develop better diagnostics, treatments and cures. HRI was established over 35 years ago now, in 1989, to fuel both basic discovery research and translational research. And today we're comprised of 15 different scientific groups and more than 150 very dedicated staff. And we work across two sites. We've got our head office and key labs here at our Newtown location, and we also have facilities at the Charles Perkins Centre within the University of Sydney. So the team is focused on delivering cutting edge, research where focused on breaking new ground. And we're also committed to improving the health of Indigenous and Torres Strait Islander people. That's a really important focus for us. And to facilitating opportunities for women, building careers in research and science too, and encouraging women in STEM. And so why does all of this matter? We want people impacted by cardiovascular disease to have more time with the people they love. So that's really what drives us each and every day, and keeps the researchers really focused and dedicated to the work that they're delivering. So let's get underway tonight. I'd like to introduce you all to Dr. Johnny Liu. Johnny completed his Bachelor and Masters of Biomedical Science at Victoria University, Wellington, New Zealand, in 2012. And he then moved to Sydney and conducted his PhD under the supervision of Professor Richard Payne in the School of Chemistry at the University of Sydney, and graduated in 2016. And his PhD focused on developing new methods for sulfopeptide synthesis. That's a mouthful.
Yeah, that's good.
And evaluating sulfopeptides' biological activity.
Yeah.
In his postdoctoral work, he worked at the Cornell University and at EPFL.
Yep.
Under the guidance of Professor Yamon A. His postdoctoral research focused on hijacking endogenous lipid and electroprofile signaling pathways for precision medicine development. And the contribution of this work to anti-cancer research was recognised by Cornell University, and he was nominated by the university for the Black Award in 2018. Johnny was awarded the Sydney Cardiovascular Fellowship and joins HRI to start his independent research in developing new chemoprotective platforms for the identification of novel therapeutic targets for cardiovascular disease. And in 2023, you were awarded one of two New South Wales researchers that was awarded the DECRA Fellowship, which is considered to be the leading fellowship in Australia for young research investigators. So that's a pretty impressive track record.
Thank you.
So to start, Johnny, you're building a really wonderful career in science and medical research. Tell us about you. What motivated you to pursue a career in medical research, and what keeps you going?
I guess firstly, I want to thank Andrew and Katrina for the nice introduction. I also want to thank there's so many nice donors and people coming to listen to my seminars and provide a lot of inspirational advice on my science already before we even start. This is not really planned. When I was 14 and 15 years old, I used to be good at maths and physics and chemistry, but there's never a systematic plan. And my dad was used to work in a bank. He was thinking I would become a banker at the end. But it happens quite suddenly. One of my uncles, who is very close to me, he used to be a basketball player and he's very fit. But suddenly he had a heart attack one day when we were doing a hiking all together. And when we delivered him to the hospital, it was a bit too late. The cardiology find out he had a heart attack because of atherosclerosis. But that was like 20 years ago. So the biomarker screenings and all the surgeries is not very cutting edge at that time. So there's not much we can do. The only advice is ask him to eat healthier, quit smoking, quit drinking, and hope all the best. You may be able to survive for another 2 years. That's the advice of the cardiologist at that time. That was 20 years ago. And he followed the instruction, and quite surprisingly, he followed it very strictly because he was served for the army before. So he's really strict about every single step the clinician mentioned to him. So he managed to survive for another 15 years. That's a huge surprise. And that really changed my mindset about actually I need to do some chemistry for something useful and to understand how the way we eat, how our lifestyles could affect our health. And I'm always intrigued by I used to do some meditation, but I nowadays I feel like, why don't I just find a molecular link between nature's and our health? So I think studying cooking chemistry, which you will hear some of them tonight, is a very good way. It's a good way for my aspiration as well to find out the actual link between our health and the nature.
And you lead the Cardiovascular-Protective Signaling and Drug Discovery group within HRI. What does that mean? Tell us about what the primary focus of the group is and what you're seeking to achieve and what difference your work will make.
Yeah, thank you for the question. I think signalings to most of us will be, this word may pop up when you're waiting, got stuck in a city train, right? The driver will tell you, oh, we have a signaling problem. Unfortunately, you need to wait for half hours. That's it sounds like a bad word to you, but actually signaling is really important for us to survive. We evolved this mechanism for millions of years to optimize the signaling pathway in our bodies. One of the very simple way our body evolved is to sense pathogens such as bacteria and virus, like COVID-19. When it start to infect your lungs actually will do some signaling to signals macrophage and other white blood cells to try to neutralize the virus. So this is a very fundamental signaling. Can the next slide? More related to cardiovascular disease is one of the clotting cascades. When you are, this is a very important mechanism that evolved from our ancestors millions of years ago when we are still fighting the predators. When we have a scratch or playing with our brother and sisters, you will get some damage and you need to have a very rapid signaling pathway in order for your wound to heal. And this is what we call signalings in a scientific term. And as we know, this is very important for clottings and cascade. But the problem is, don't mind go next one. This has been evolved for, we evolved since we were primate, when we have been optimizing, tailoring the systems to the environments. We spend almost 2 million years or 2.5 million years to optimize that. And now, when we are entering the industrial centuries, and now even the AI century, we don't actually need, we still need to heal our wounds if we cut our fingers during the cooking process, but we don't need that as often as before, right? So this system is somehow activated if you are eating KFC, eating a lot of McDonald's and healthy food is somehow activated. It's kind of ready for clottings, but we don't actually get a cut in our bodies. So, oops, that's pretty drastic change. Yep. So that's when you don't have a stroke. That's you have a healthy smile. No. So occasionally, especially if you sit a lot, and we are eating McDonald's when you're sitting, those high lipid content in your burgers may somehow trigger clot formations in the vein. Okay, so that's why sometimes you get some numb feelings of your fingers or legs. This is, to most of people, is still okay, just blocking one small artery, you probably can still survive. But the problem is when this clot getting a bit loosens and let your blood carry your clot all the way to the brains, that's where the devastating things could happen. That's what we call stroke, or one type of stroke, one of the common stroke. These clots will potentially block blood supply to the brains and leading to a very immediate acute symptoms that you need to escort to the hospital trying to remove the clot from the brain. So in terms of signaling, so that's why we want to study how to modulate this signaling pathway so we can still preserve our life-saving mechanism so you don't get bleed to death when you are just have a knife cut or paper cut. But at the same time, we don't want it to turn on all the times. We want to tune down the response of the clot formations so that we don't easily get stroke. So that's one of the focus of my lab.
And I understand too that the lab is focused on looking at next generation therapies, and in particular looking to nature to find those solutions.
Yeah. Cool.
So you develop and mentor a very talented team of researchers. Would you like to introduce us to your team that are up there on screen?
Yeah.
And tell us a little bit about each of them and what they do.
Yeah. I think this is a really nice image. I really like it because that's where we have this so-called escape room activities, right? When we do the team building activities. But in fact, when you're doing medical research, it's just like escape rooms. We need a team of people to collaboratively work together in order to escape this room. In this scenario, will be lying the clots in the brain, in the patient's brain, to recover them from stroke. So, this is me 3 years younger than now. The teams on the right are so-called the biology teams. They are helping me to get patient samples, also engaging with the patients and discuss about what our research could potentially benefit their health. So they are the biology teams. They do a lot of signalings analysis and see whether the patient actually have some, harmful signalings happening in the blood. So we can analyze their data. The one on the left, Sarah's, Aggie's, and Kayla's, they are brilliant chemists. They actually can make a chemical compounds respond to the disease as quickly as possible. So of course, we are not using the patient to test the drugs, but at least we have a solutions trying to address the problems and test them in the models. And these two gentlemen here is actually they are both interested in biology and chemistries, and they are actually medicines students at the moment. So they are actually helping us to provide some clinical advice during the research.
Okay, terrific. So how are you and the team going about developing more effective cardiovascular drug treatments or therapeutics? And how is the investigation of heart-healthy diets assisting you to develop more effective drug treatments?
Yeah, I think I just put up a couple of slides. Oh, it's me again.
You really don't want to go away, do you?
Yes, exactly. Yes. Back to the previous one. Oh, cool. Thank you. I think before we go into the methods, I'll just briefly talk about the stroke problems. So stroke is the second most cause of death and disability in Australia. On average, we have about 50,000 cases per year in Australia, just in Australia. And we are spending almost $32 billion to manage the patients and in terms of curing them and managing them if we can't cure the patients. And about 55% of the cases are caused by the clot relocations, as we mentioned, from the leg to the brains or from the hand to the brains. This is clot relocations is a major reason causing the stroke. Go the next. Yep. And one of the shocking facts is that we only have one drug approved since 1990 for the treatment of stroke. That's called T2 plasminogen activators. And these drugs, what it's doing is to help us to lyse the clot, to dissolve the clot, or so-called clot busting drugs to dissolve the clot in the brains so that we can infuse the blood to the brain for the supply. But the problem with this approach is that only 30% of patients benefit from the treatments. The other 70% will still remain getting the stroke conditions. But that's the best we can have at the moment, unfortunately. So, and then blood thinners, the common blood thinners you can buy from pharmacies has been shown statistically, to improve the outcomes of the treatment with TPA. But it never get approved because at the same time, when you have TPA, tissue plasminogen activators, and blood thinners used together, that will massively increase your bleeding side effects because you compromise your whole system being able to form a clot. So that's we know it's going to work in terms of helping you from stroke, but at the same time you may run into a risk of getting too much bleeding during the surgery. So that's why it never get approved. So our missions is to use a natural way to identify safer blood thinners for the health of stroke, as well as many other clot dysregulation disease. You want to go to the next one? Cool. All right, so inspirations. As you know, I discussed with you about my uncle's case. Eating healthy help him to last for another 10 years or 15 years to live. So I will always inspire with eating healthy, how Mediterranean diet, how specific Asian diet actually improve our health. And if you manage to read those papers, those are documented 15 very famous clinical trials about how Mediterranean diet improve our health. Those are the summary of the statistics. On average, you have about 30% less risk to get cancers, heart disease, and stroke. And if in the case of COVID-19, you may have 28% less chance of getting COVID-19 if you are eating Mediterranean diet. But as a chemist, I noticed the pitfall here, the problem here is that they all discuss about vitamin C, vitamin E, all those common antioxidant agents you can buy from pharmacy. But the problem is you can eat any vegetables to get vitamin C and vitamin E. So what's special about Mediterranean diet? And what's special about broccoli? Because broccoli has been frequently documented in the papers that eating more broccoli is really good for your health. So we start to look into the chemicals. I don't want to bore you with all the chemical structures here. So that's the only one slide I have with all the chemicals here. So bear with me for one sec. But we look into all the chemicals we can extrapolate from the Mediterranean diet, and we classify them. We put them into different format and to test them, and we notice indeed certain chemical isolated from broccoli is actually very good for your health.
So one thing that I would like you to explain is what is sulforaphane, and how is it being applied to address your work in stroke, and why could this be a better way to treat stroke?
Yeah, I think the best way to explain sulforaphane is to show you the actual research data we have here. So sulforaphane is a bit mouthful, but is one of the major natural products you could acquire from broccoli that you could not acquire from any other vegetables. Actually, there are other, like angel on brassicas also have sulforaphane, but this is very unique in the brassica vegetable families. If you want to know more example, I'm happy to discuss with you about other vegetable may provide you sulforaphane. But that's the molecule come up in the screenings. This is scientific data. We don't have to go into the data. We can look at the image at the bottom. So that's me before eating broccoli. My student take my blood and perfuse on a chips that you can visualize with cameras to see how my blood clot formings in the context of some stroke pathogenic agents, and to trigger the clot formation. So you can see that's the regular size of a blood clot formation in the context of stroke condition. Of course, I haven't got stroke, but they take my blood and perfuse to something with a stroke condition. That's me after eating 1 month of broccoli. Broccoli is the only vegetable I ate for that month. And
Broccoli were you eating every day?
Well, it's a good question. Yeah. It depends on the way you cook them as well. But on average, I'm eating probably 300 grams broccoli a day. Yeah,
That's a lot of broccoli.
that's a lot of broccoli. So, yeah. But you see how I committed to my science, right?
Yeah.
So that's me after eating broccoli for a month, and do exactly the same conditions under stroke conditions. Okay, so you can see much smaller clot formings. Yeah, but of course I'm still able to heal my hands properly. There's no problem with my healing process because this is not a traditional stroke condition, right? You're healing your skin, healing your paper cut. It's a not traditional stroke conditions, but you can see the massive difference with me, n equal to 1. It's not probably the best clinical trials ever, but I'm convinced with my science. Yeah. Can you go to the next one? Okay, so if you are not convinced, you think, oh, he's a bit biased. He loves his science. That's why this happens. So we have poor mice here. We have some poor mice data here. So regardless whether he liked it or not, we feed them broccoli meals. And we introduce a stroke condition to the mice. And I'm not sure how familiar with the bar graph, but I can point you to the bar graph. The one on the left is where the mouse subject to TPA alone. So we don't give them the broccoli meals, just TPA alone. You can see only 20% of mice can be saved by the TPAs, and 80%, which represent by the black color here, is still getting stroke after the operations. Okay, if you force the mice with broccoli meals or broccoli extracts, and you can inject to the mice through the veins or through the skin. And after this, you can see a massive improvements. So the gray area suggesting partial recoveries. The black is no benefit at all. And the white bar here, 30% of mice is completely walk out the surgical theaters like normal mice. So broccoli is still not, the magic bullet, but if you're eating a lot of broccoli, you can potentially survive much better compared to the other individuals. Yeah. And this one on the right is a bit boring, but we are testing the bleeding times. So you can see with huge amount of broccolis on the right compared to the left ones, you don't really see any difference. So the mouse can still heal like a normal mice. But in the context of stroke, eating a bit more broccoli probably will help at some point.
Now, you've also highlighted in your work that despite the global burden of cardiovascular disease, the development of new cardiovascular drugs has largely stalled over the past 2 decades. Why has the development of new drugs stalled?
I think if we can go to this, yeah. So one of the problems with new drugs from scratch is that there are a lot of regulatory pathways. So majority of the research happening in the university or medical institutes is happen on the left-hand side. So we introduce a lot of novel cutting-edge technology to get new drug molecules. But once we go to the clinical trials, safety is a major concern in cardiovascular research. It's not like cancer drugs, right? Cancer life expectancy is not as long as you would imagine for cardiovascular disease. So safety is not as important as coming up a really good drug for thrombosis, for stroke, and for other cardiovascular disease. So we actually fails. We are not failing in the university level or medical institute level, but we are failing in terms of have more efficacious approach to enhance the safety of the drug molecules. So you can see more than 90% of drugs did not get approved by phase 1 trials. Phase 1 is you either take patient very, very sick, there's no other method to cure those patients for testing the drugs, or you are taking a very healthy individuals and looking at the side effects. Okay, so phase 1 is a combination of these two methods. Well, nevertheless, we are not doing very good on phase 1. 95% of the drugs are fails because they are not very safe.
And part of the work that your group does is focused on repurposing existing drugs for next generation cardiovascular disease therapy. What does the process of repurposing drugs mean?
So I think the top row tells us in a cartoon fashions, we spend a lot of time and money to come up new drug for cardiovascular disease, but we know it's not really working because the safety is really high. The bar is really, really high compared to cancers and other devastating disease, such as COVID-19. The bar could be lower for COVID-19 drug because at that time it's a medical emergency. But for cardiovascular disease, the bar is really high. So that's why our lab trying to get from other molecules, such as from vegetables, that we know is going to be extremely safe. So we just test them on a laboratory model to show that they are efficacious And we hope this approach can really accelerate drug developments in the context of stroke, thrombosis, and heart attacks, and other cardiovascular disease. The other approach, so-called drug repurposing, is to repurpose drugs used for cancers, approved for cancers and neurodegenerative disease, inflammations. We use them for stroke and thrombosis. And it sounds a bit weird, but actually when we do it in the laboratory testing, it seems working very well. Should we go to the next one? No. Yep. So in collaboration with Professor Arnold Jones in the School of Biomedical Engineering, we developed a screening platforms to rapidly screen other drugs for cancer, drugs for inflammation, drugs for virus. We screen things in the context of thrombosis and heart attacks, and we see whether we can reuse those drugs for those diseases.
Okay, great. So Johnny, tell us, what's the thing that you've discovered in your scientific career that surprised or overwhelmed you the most?
Yeah, cool. I think one of the surprise we have here, actually related to our last questions, is that this is common anti-tumor drugs, right? Anti-breast tumor drugs. We know they are working for breast tumors. But when we actually use them against stroke and thrombosis, so this is another assay, we are looking at the red colors. The red colors are suggesting these patients tend to have a massive clot in the screenings. But when we use these drugs on this patient's blood, we can see a massive decrease in clot formations. And this is an anti-cancer drug. You are not supposed to use that for thrombosis and clotting purpose. But with this screening platform, we are managed to identify new medication and approach. If we go to the next one, I guess another surprising thing is I always like one of philosophers' quotes. I think it's called by Louis Feuerbach. You probably may not heard of his name before, but his famous quote is "Man is what he eats." This is really intrigues me for my science, because I always wonder whether we can, do a portrait one day looks like this. This is a famous portrait called Fortunus. It's a portrait for Roman emperors Rudolph II, is to admire his contribution to the countries. But hopefully by the end of today's seminars, I can convince you that we are made of vegetables in some sense, because eating more healthy vegetables may provide cancer-fighting effects, as well as stroke-preventing, blood-thinning effects, and to some extent, the brain-protective effects. And you don't need to care about the chemistry at the bottom. Those are the, the nitty-gritty details about how we deduce these logics. But we are seeing the vegetables affecting all aspects of our signaling pathways in the body. I think that's what really striking me and motivating me for doing my research.
I've seen that image and portrait before, so I'm always going to look at it in a very different way now. So what's the thing that has made you the most proud throughout your career to this point?
Yeah, I think I'm very proud of my teams at the moment. They are very committed teams and share the same interests as me. I'm also feeling lucky that I've been trained and supported by many clinicians and world-leading professors. So I feel very fortunate about that as well.
Okay, terrific. And what are your dreams and what's your vision for research related to cardiovascular disease into the future?
Yeah, I have two big dreams in general. The first one, I think both of them are really close to realize the dream. The first one is the quote I mentioned: "Man is what he eats." Right. So I think I have really solid scientific evidence to suggest man is indeed what he eats. Right. If you're not eating healthy food, your risk of getting stroke and cancers are much higher than people eating healthy food. And the second dream is to develop a new ecosystem. I know people like this word nowadays. They like to have ecosystem of cars and cookings and air cons. But my ecosystem is more for the cardioprotective perspective. So we have a brief touch on the screening platform we developed with UCIT, Professor Arnold Jones. We are hoping to make it, a point of care in the future, just like testing diabetes, blood glucose levels. We want to make it really minimize device for you to test your thrombosis risk, your stroke risk. And I'm hoping to develop a drug libraries at HRIs. So once we got this data, we can use this robot to pick particular drug for your screenings to have more personalized medicines in the futures. And the big dream, but I think the dream is coming true, is to use AIs to integrate everything we have at the moment and ask the AI to come up with magical formulas for your personalized treatment to prevent stroke and thrombosis.
I think that's a very, very exciting vision. Thank you, Johnny. Thanks. So what's needed to take your groundbreaking research forward and to continue deliver the breakthroughs that you are?
Yeah, I think we are certainly we are still applying for funding to support this dream to come true. And we need some cutting edge instruments to make it work. But I'm very proud of my team. My team are trying all their efforts to make this to come true.
Well done. Thank you very much,
you.
Johnny, for that terrific presentation.
Don't worry.
I think the work that you're doing is hugely exciting. So I look forward to seeing the next steps unveil and evolve. I'm going to open up now to questions from the audience. Are there any questions that people have?
Brussels sprouts.
Yeah.
Brussels sprouts.
Brussels sprouts, okay.
Oh,
Broccoli, the sulfur glow. The
Yeah.
sulfur thing.
yeah. I think you are bang on. So Brussels sprouts, I think we just discussed that during the drinking.
Yeah.
So we are going to publish a papers about ranking different vegetables content of sulforaphane, the mouthful chemical we discussed. We will try to do a research article about which vegetable has the most sulforaphane content and how to cook them properly in order to release as much as you could. So I think you're right. Brussels sprouts at the moment is the winning vegetables among all the ones we have tested so far. You like Brussels sprouts? Oh my God.
Right, so how you cook them?
Yes, any tips on cooking?
Cooking, yeah.
Yeah.
Okay, I have to make a claim. I'm not a chef. I did mention a lot of time about cooking chemistry tonight, but I'm not really good at cooking in general. But these chemicals, one of the problems, I think I talked to Judy in the welcoming sections. One of the problem of why we need to eat so much broccoli in order to have the benefit is that the compounds decompose or get destroyed during the cooking process. So if you're cooking the broccoli like a traditional way, like pan fry, I don't know whether pan fry is traditional way.
Instead of
Boiling. Pan fry is an Asian traditional way of
That's
cooking
better.
broccoli. Yeah.
keeps more in.
Yeah. So most of those ways would destroy 90% of these natural products before you put that into your mouth. Okay, so that's why you have to eat way more broccoli to extract the remaining 10% in the broccoli and to be absorbed. So I think when we do the initial testing as well as reading some paper, steaming is probably the best way. Yeah, but you can only steam it for 2 minutes.
But I do.
Yeah.
Okay, so what about blanching?
Blanching. I think blanching is a good way. Good way. We're trying to, I don't know, we have been doing a lot of decent search. There's no company make blanching broccoli juice.
Okay.
There's no, we literally, we can't find, if you can find one, please tell me. We just can't find any station selling blanching broccoli juice.
There's an opportunity.
That's an opportunity, yeah. We need to file patents. And we need to file patents for blanching broccoli juice.
You know, you could use an asparagus cooker. You know how the asparagus cooker's about so big, round, and about that, and it's got the little olive.
Oh, yeah.
And when you're cooking asparagus and you don't want to overcook it, you boil it, boil the water, and then that's the blanching.
Yeah.
And you could do the same with any vegetable, I'm sure.
Yeah. Sounds good. I think you actually remind me, one of my students point out we can do the, I can't pronounce the word, it's a French word, the sulfide.
Souffle.
Souffle. Yeah, souffle.
Souffle.
Yeah, souffle.
Souffle.
Sous vide.
Okay, I thought you were saying souffle.
Go ahead, man.
Okay.
Sous vide, because you are not immersing the broccoli in the waters. You just put them in the vacuums and put them in boiling water. So all the natural products still retain in the broccoli. So I think that's a good way. Yeah.
And you were mentioning soup to me earlier too.
Yeah. So it's similar to blanching, I think. But the soup, I actually have a collaborator in West Australia. She's a dietitian running broccoli clinical trial for patients, but not for stroke. Yeah, she told me that for soup, you need to boil the broccoli for 80 degrees to make the soup, not boiling, not boiling, just slow cook. And you drink the water, that's fine. I think majority of the natural product will get into the water. The natural product has a very low boiling point, if you know what that means. So low boiling points. So if you do a pan fry, which you can heat up to 200 degrees, you can just evaporate all the natural product into air. So that's not a good way to retain the natural product.
About all the chemicals that are in our vegetables these days, you know, I mean, is that taken into account?
Sorry.
All the chemicals that are used to grow our vegetables these days, is that taken into account in did you use organic, or can you be assured that it is organic if you buy organic?
Yeah, I think that's a very good question. I don't know the answer for sure, but I do, when I read the scientific articles, I notice people purchase broccoli from different source, organic source or chemical cultivated source. They do see different abundance of sulforaphane release. Yeah. I think keep track of which cultivar they use for that, but presumably the organic will be the better one. Yeah.
Sorry.
Oh. Okay. I was just wondering if you go on a broccoli diet and you're on warfarin, does the INR change, or do you have to modify one or the other?
That's a very good question. I mean, we do have data, and other people have kind of data to show that eating a lot of broccoli would not compromise your clotting potential. So at the moment, I think will be, you don't need to worry about that. That's my response at the moment.
I think it has more vitamin K, and that antagonizes the warfarin. You have to readjust. But then you've got to keep the same amount of broccoli every day, the same freshness.
Yeah.
It makes it very difficult.
Yeah.
There must be some cardiologists here who know it better than I do.
Okay, you need to have a regular blood test if you're on the warfarin, so try and avoid that.
It probably doesn't affect the other anticoagulants.
No, shouldn't do. They don't.
Shouldn't affect the
I didn't show you the actual science. I think broccoli is acting on a very distinct pathway, so I don't believe it will compromise other anticoagulant or antiplatelet effects. Yeah.
Jody, is there any supplements, and I know this is an area you're looking at, that is on the market today that would replace eating 300 grams of broccoli each day?
I think I do think Blackmores has a product of broccoli powder as a supplement, because I did think about this when I was writing the papers. So I have been Googling broccoli supplements provided by different. Yeah, I think Blackmore does have a broccoli supplement, but I've been trying to find it in pharmacy, in my local pharmacy. I just couldn't find it. It's probably not the top selling product.
You might be after tonight.
Yes, I mean, yes. Thanks for your support.
Just an amazing.
Other questions that,
How do you make it in the lab?
The chemical.
Yes.
Yes. We indeed, we try to compare what we make in the labs. First, what we extracted from broccolis, just in case we are looking at the wrong chemicals. So I think they are comparable in general. I think making in the labs usually would requires FDA approvals if we want to do clinical trials. So I think extracting from broccoli would be a healthier approach, a less risky approach we know the chemical will be the same, but you know, it just create additional concerns when we do clinical trial.
Johnny, have you any idea how many of our conventional drugs actually derive from plant extracts? You know, is it a tiny percentage or a reasonable percentage?
I think it's quite reasonable percentage derived from natural products, especially those leading anti-cancer drugs like Taxol is isolated from medicinal plants. But they all has been engineered at the later stage because I think Taxol is a famous story because when Taxol gets discovered for tumor disease, it's become so efficacious, so they actually eradicate the whole forest of, you know, Taxol plants. So at the end, it's just not sustainable. So that's why the chemists come in to make them, synthesize them from scratch. So obviously, broccoli probably won't have these problems, but who knows, right? So yeah.
Would broccoli supplements be of any assistance to someone who's already had strokes?
Yeah. Again, that's the data I will show you. We recently collaborated with a group of neurodegenerative disease biology teams in Macquarie. They approached me initially more for Parkinson's disease, Alzheimer's disease, not for stroke, but I managed to convince them to test on stroke models. Yeah, I think after the mouse gets stroke, just continuously feeding them these chemicals. We are not feeding them broccoli. We're just injecting the chemical through the veins. Yeah, we see a massive recoveries, helping the neuron to recover from stroke. Yeah. I think it will improve about threefold compared to without treatment with the chemical.
How far away do you think this is from a patient perspective, and what do we need to do to get it there?
I think that's a very good question. We have to look at it from two aspects. Making a new drug is really expensive, and when doing all the clinical trials are expensive. And one thing we haven't got time to discuss, or I've put to bring up here, for cardiovascular disease, especially strokes, it's much more expensive actually compared to other disease because it's just really hard to predict someone who gets stroke, right? So you can recruit a patients with diabetes or high risk of likely to get stroke, but sometimes you need to wait for 10 years before they have their first stroke event. So this whole cohort actually becomes really time consuming and very expensive. So that's why the pharmaceutical company don't want to do this type of drug discovery because they feel like they invest too much money and too much time on the clinical trials. Back to the broccoli stuff, if we want to just chemically make them to become a drug tablet, I think we will get to the same tracks. Like we need to wait for pharmaceutical company to convince them that's worth you to invest money on the things. Alternatively, we can think about supplements or dietary clinical trials, just giving force patient to eat broccoli. or you can wait for my scientific paper to publish how to cook broccoli in a better way to preserve more chemical in the broccoli, so you don't have to eat that many broccolis a day. So that would be, I think, more realistic approach. Otherwise, I think we will never get any improvement in the stroke trials.
Last one. I mean, at the moment, you say there's something in broccoli, you can identify it, but I understand you can also modify a drug and make it more effective or safer or longer lasting. So how important is that secondary optimization process?
Yeah, I think you're on the spot. So sulforaphane, let's say take sulforaphane for examples. You will lose 90% if you do pan fly or deep fry your broccoli, you will lose 90% of them. But when you are ingesting sulforaphanes, your liver somehow will kill another 5% of sulforaphane. So every step you lose almost 50% of sulforaphane before you get into your brain to protect your brain. So I think modifying them like packaging with nanoparticles, those cutting edge things, or even we can package them as a nanoparticles and as a nasal spray. So we can spray into the mouth. So nasal has a tunnels to connect directly to the brain without passing the liver. So that will be what we are starting as well. We can make an eye drops. We know it's going to be safe as well. We can make an eye drop, so use the eye to absorb into the brain as well. There's multiple ways we can do. And of course, modify them to prevent liver degradation will be a good way as well.
Hello, Johnny. You said that we need to eat 300 grams of broccoli. How many kilos of Brussels sprouts do we have to eat?
Depends on how you prepare Brussels sprouts, I guess. Yeah. If you eat it as a salad, oh yeah, you probably can get away with like 20 grams or 30 grams of Brussels sprouts. Yeah. You can cope with that. Yes. I can cope with that too. Alternatively, what's the other one we had? Kale. We mentioned about kales. So okay. But confidential. We haven't published that yet. But Brussels sprouts number one. If you have 300 grams of Brussels sprouts, you are going to absorb about twice much compared to 300 grams of broccoli. And kales is number three. Kales number three. And you can blend kales with.
It was a good question there. What about putting it in a blender from Ian? No cooking. Is that an effective way?
That's the best way. Yeah, if you can blend broccoli without cooking, that's the best way. Yeah.
I suppose just water.
Can I just say, I love where you're going with this. I really do.
Thank you.
It's going to be a bit more of a battle, though, don't you think, with the current generation of people, microwave meals and all that kind of stuff, fast foods and education is going to have to be a part of this, isn't it?
Yeah,
at some point. Yeah,
that's true, and that's why we need Katrina to have more seminars, to hopefully bring more young generation to the seminars to educate them. Yeah,
thank you.
I think that's a good point overall, though, in terms of people's general health.
But by the way, microwave is the worst way. There's a scientific paper to show that microwave is even worse than pan fly.
Yeah.
You don't want to microwave your broccoli. Yeah. If you just want to absorb the nutrient by eating broccoli, don't microwave it. Don't microwave.
But I think returning to, eating food that's as close to its natural unprocessed as possible is good for general well-being.
Yes.
I've just got a simple question. So, well, a couple of questions, just related to the broccoli.
Oh, sure. Thank you. So, just related to the broccoli, the best way to cook it, if you're going to cook it, the best way to cook it currently would be to steam it for a maximum of 2 minutes.
2 minutes,
right?
yeah.
Okay.
There you go. We got a take-home message tonight.
And one more question. I've got a Nutribullet. They're just wonderful for making fresh juices and that. I'm just trying, and I would normally probably put in a fruit juice rather than water. So I'm just trying to imagine what else would I put in there to make, if I put broccoli into the Nutribullet, what else could I put in to make it actually drinkable? Well, I don't want to make it sweeter or anything like that, but is there another fruit or another vegetable? I mean, you mentioned carrots. I could put carrots in.
Yeah.
Apples.
You should all join my summer project. I have a summer project about how to make broccoli taste better.
And just one more question, Johnny. Is it in the florets or whatever you call the flowers, or is it in the stems, or is it in both?
I think based on the research, the floret has about 60-70% of the active ingredient. The stem only 20 or 30%.
Okay, that's great.
Yeah.
Because it's going to be much easier
Yeah.
to NutriBullet floret. Thank you. Thank you very much.
And another thing, I think I talked to Judy during the drink as well. Our summer research is focusing on how to make broccoli taste better, and we are thinking to make it a broccoli pesto sauce.
Yeah.
And we're going to measure, whether that will be the active ingredients still inside the pesto and sauce. Yeah, we'll see how it goes.
Blending it could have an effect on it as well.
The blending actually make it better. Yeah. And actually, there's another thing. If you like, okay, we talk about Brussels sprouts, broccoli, and kales, and equally important, like kales, is wasabi. So if you like Japanese sushis, and the pungent smell is actually correlated to the chemicals. So wasabi is another alternative.
Don't
Goes
eat
straight to the
300
brain.
grams of that.
Actually, the wasabi's pungent smell is inspired us to do the nasal spray approach, because that's one day when we have wasabi gathering. That's what we do.
Oh, Linda's got a
Linda.
question too.
Yeah. Broccolini, yeah, certainly, yeah. We haven't tested the content. We know it's going to be the same family, so it will have some these natural products, but it's not on our ranking table yet. We haven't done this research.
Well, thank you so much, Johnny. That was really, really wonderful conversation.
Thank you.
So thank you very much for that. And thank you too for all of those really wonderful questions. It's great to have such interaction from people on these evenings. So thank you.
Yeah, I've already seen some volunteer want to join my summer project.
Yes, Johnny is recruiting. So let us know. Put your hand up if you'd like to be involved. We'll take your names later. I would like to thank everyone for coming. If you have enjoyed and learned something this evening, we have a takeaway message in terms of steaming broccoli for 2 minutes.
Yep. Don't microwave it.
Don't microwave. Please do share it with people that you know. Share it through social media. Share it with your family. Share it with your friends. And we would welcome any new people that you would like to join to come along. HRI is always open to bringing friends, family through to tour. So we thank you very much for coming along this evening. Oh, we've got another question here.
No, just a request at the end, if
Yes.
that's possible, from the photographer.
Yes.
Could I get a group shot of everybody up the front?
That would be wonderful.
At the end, would that be
Is
okay?
everyone happy to do that?
May I ask just one question?
Yes, sure.
Do you have any input in schools?
We don't have school groups that come through. We don't have an established school program at this point, but it is a great idea. Yes. Yeah.
Because it's that generation.
Yes.
Yeah.
Yeah.
So if there was somewhere that students who study, food tech and things
Yes.
like that,
Yeah.
Yeah.
if they learn when they're really young how to cook Brussels sprouts,
Yes.
Yeah.
by the time they're my age, they might even eat them.
It's a fabulous
Yeah,
idea.
yeah,
That's
I think
one
so.
for us
That's
to.
great. Yeah.
Maybe we can recruit students for your
Yeah.
summer program as
Yeah,
well.
definitely. Yeah, I think
They may be able to carry the message to their parents.
That's right. Yeah, absolutely.
Yeah.
Yeah.
that's the dish they cook. They have to try it.
That's right. They'll demand Brussels
Yeah.
sprouts at every meal. That would be a dream, wouldn't it? Well, look, thank you everyone for coming along tonight, and we look forward to seeing you again very soon. So thanks again. Have a lovely evening.
Yeah, photo. Everybody up. Everyone to the front.
Where would you like us?
Everyone congregate at the front. Obviously, the shorter people at the back and the smaller people at the front. Self-select. And maybe Johnny and the team, with the code towards the centre.